Service Dogs and DMD by Andrea and Carolina. Duchenne muscular dystrophy is caused by a mutation in the largest gene of the human genome that causes the protein dystrophin to become non-functional. The protein dystrophin is an essential component of the dystrophin glycoprotein complex that serves to connect the actin filaments in the skeletal muscle cell to the extracellular matrix. This helps prevent contractile-induced injuries to the sarcolemma membrane of the cell. As the DMD disease progresses, it's typical of patients to suffer from walking problems as early as 5 years old. Individuals with DMD become non-ambulant by 10 years old and progressively develop other motor functions such as using their arms and even their lungs. Those that are afflicted do not live past 30 years old. 1 in 3,500 males worldwide are born with DMD. Unfortunately, there is no cure for Duchenne muscular dystrophy yet. Scientists and clinicians are working to develop drugs that may help reduce the severity of the disease and hopefully will find a cure soon. Treatment options include gene replacement therapies like introducing a truncated dystrophin protein delivered via viruses, editing therapies that restore dystrophin function, rehabilitation services, and the work of caregivers. People with DMD rely on multiple experts and services. This includes the work of fellow furry companions. Service dogs are a great option for people with DMD. However, on average, it takes about $40,000 to $60,000 to train a service dog for people with disabilities. However, many organizations like Paws with the Cause, among others, have fundraising committees dedicated to raising money and helping with the costs. Most of the time, patients do not pay anything. So how can you get a service dog for your child? Many organizations have these 4 main requirements. 1. An application process that verifies the disability by a certified physician. 2. An interview process with the dog. It helps both the dog and the child see if they're comfortable with one another. Most of the time they are. 3. Official acceptance. 4. Payment/fundraising. So should you get a service dog for your child? One of the major benefits for children with DMD is that they gain more independence once they do have a service dog. For example, service dogs can be trained to pull wheelchairs up ramps and onto sidewalks. They can also help their owners move in and out of their wheelchair. Service dogs can pick up dropped items and fetch items from other rooms, which is a vital service for someone who may find getting around difficult and painful. Another benefit is that service dogs can help improve mental health. Looking after a service dog gives people something to focus on other than their illness. Having a companion when out in the city helps patients feel more at ease and thus reduces anxiety levels. Lastly, other things you should consider before you get a service dog. 1. Is there someone who can look after the dog? The dog needs to be fed and groomed. 2. Is your living situation accommodating for a service dog? You need to live in a place big enough for the service dog to get around. 3. Do you have any other pets? Most service dog providers recommend that the dog is the only pet in the household, so if you already have other dogs or cats, it may be a problem.
Oh, good boy.
A classic story of a boy and his dog, but this isn't just any boy. And this isn't just any dog.
He gives us smiles and memories and is so helpful to Brody.
You see, in the last few months, Brody has lost the strength to walk on his own. He has Duchenne muscular dystrophy, a rare disease that's eating away at his muscles. But through it all, these last few months, Platy's been there, lifting spirits like he lifts remotes.
Good boy. And when I drop stuff, say when I'm doing my homework, he automatically picks it up for me, and I don't have to ask him to pick it up.
A boy and his dog, not knowing what's next in their story, but ready to face it together.